Well, one of the things parents worry about the most is when their child starts to look or feel sick. Pediatricians say parents should follow their instincts, but there are also a few good, hard, and fast rules to remember as well. Eyewitness News reporter Lisa Colagrassi is here now with more.
And you always worry that you're being paranoid. You don't want to call the doctor all the time, but there are a few guidelines to consider based on age and symptoms that parents should never ignore.
It's a relief when your child is finally at the pediatrician's office and in expert hands. But figuring out when to take him and when to just wait and see can be confusing. According to pediatricians, one guide to follow is a temperature, and the baby's age can be your guide.
Fever above 100.3 in any baby under 3 months, get to your doctor that day.
For babies between the ages of 3 to 6 months, the temperature can get to 101 before parents need to call the doctor. For a child over 6 months, there's a little more leeway.
If you have a kid that has a fever and they're a toddler, if it's above 101 and lasting a couple of days, or they're just not looking right to you, get seen.
Pediatricians say older children should see their doctors if their fever reaches 103. But fever is not the only sign. A consistently dry diapers in babies or a sunken head could be a sign of dehydration. Any child who is listless, very irritable, or confused, well, then it's time to check in with the doctor. Dr. Rome says if a child awakes in the middle of the night with stomach pain, it could be the sign of something bigger.
Things that wake them from sleep may actually need to be sorted out. For instance, belly pain that starts around the belly button, moves down to the right lower side, can be a hallmark for appendicitis.
And that obviously means it's time to call the doctor. The American Academy of Pediatrics have a new symptom checker tool that they've put online. We've linked it to our website, 7 Online. It's also available as an iPhone app. You can get that through the website. So it's kind of good just to have a reference, and you can check it anytime you need, to know whether you should call the doctor or not.
Yes, you worry so much.
I know.
Especially first-time parents. I remember how freaked out I was.
Right, they give you that look.
I know.
It's so sad. It really is.
Thanks,
All right,
Lisa.
Lisa, thanks.